Hi, it's Dr. Tim. In this video, we're going to talk about blepharoplasty, more commonly called an eyelid lift. We'll cover what it is, how it works, how it compares to similar procedures, and what you can expect during the recovery process. Few interventions have the same impact as rejuvenating the area around our eyes. As our brows droop with age, we begin to see more skin appear on the upper lid, and that can make the upper lid appear heavy. In the lower lid, we begin to develop bags or dark circles, and that makes us look tired. These bags are caused by age-related fat loss in our cheeks, as well as increased laxity in the tissues around the eye. An upper eyelid lift, therefore, can be performed by itself or together with a brow lift. A brow lift uses an incision that's placed above the hairline in order to reestablish a more youthful shape to the brow, and then any excess skin on the upper lid can truly be determined. We all have creases in our upper eyelids, and the upper eyelid incision is hidden along one of those creases. Management of the lower eyelid is a little different. There can be excess fat around the eye, there can be extra skin under the eye, or there can be too little fat in the cheek, or all of the above. My modern approach to the lower lid is to redistribute the fat in order to soften the transition from your lower lid into your cheek. Any lax skin can be removed in a small incision hidden just under the eyelashes, or we can hide the incision on the inside of the lid and avoid any scars. Fat grafting is another way to address lower eyelid bags and rejuvenate the cheeks. For more information, check out our video on fat grafting of the face. But for now, let's check out a couple of cases on eyelid lifts. This young lady was concerned about looking tired. What we discussed was how important the area around our eyes are at telling the world whether we're tired or how we feel. So what we opted to do in this case was a brow lift, upper eyelid lift, and a lower eyelid lift. Seen here only at 1 month after surgery, her eyes look more open and brighter. The brow does not look overly lifted or surprised, and you cannot see any scars. This case is interesting given the patient's Asian heritage. In this particular case, we wanted to avoid an upper eyelid incision given the fact that she has some skin laxity, but truly desired not having any visible scars. What we opted for is a brow lift to be able to open up the eye and make it appear less heavy. And in the lower eyelid, we were able to reduce the amount of fat that was contributing to some of the shadows and dark circles. In her post-op photo, you can see here at 1 month that she has no visible scars, she looks more alert, and no longer has those dark circles. Downtime after a blepharoplasty is about a week for both upper and lower eyelid surgery. Upper lid surgery can be performed under a local anesthetic, while we recommend going to sleep for lower lid surgery. You will have some small sutures that are visible during the first week. I will remove some of these sutures at your first follow-up appointment. Some swelling can persist for a few weeks, but patients are usually able to return to work within a few days, depending on the demands of your job. If your eyelids are telling the world a different story than you would like, we'd be happy to meet with you and create a plan uniquely suited to your concerns. We look forward to meeting you.